everybody, this is Dr. Perry from the Pain Laser Center and StopChasingPain.com coming at you. I'm going to show you today one of my all-time favorite movements that I teach every single one of my clients. So I figured I'd just film it so they can reference it anytime they want to, and then you can use it as well on your own. And it's called the Brettzel, and it's created by Gray Cook. And I really love it because it teaches a lot of different movements. So it's an exercise that gets you mobility, but really kind of teaches neurological movement. So there's a lot of cueing that I do for people. I'll try to get it as best I can with this angle, but I want to show you what I tell my clients and the things that I want them to pay attention to, because it's all about the intent of the movement. I'm not concerned about you just doing repetitions, but you know, I usually tell people to do about 10 repetitions on either side, and I have them do it every single day when they're bound up and things like that. But one of the reasons I really like it is because it opens up the chest, rotation in the thoracic spine. It gets some nice glute contraction. You get some neurological movement by the turning of your head and looking of your eyes. And you can really get a nice stretch into your quad and your hip flexor as well. So it's kind of like the equal opportunity equalizer, I like to call it. And it's a really good testament to how balanced you are on either side. So when I show people, what I usually have them do is put something underneath your head, because I want your head supported. So when you're lying on your side, your head is roughly parallel with the ground. I don't want it too high up or too low, because you won't relax. But basically what I'll have them do is lie down on the floor and just stack like a 90 degrees. And I'll put the roll, I like the foam roller a lot, and I'll put the roller towards the back of the head, because when I turn and rotate, my head's going to move, and I don't want it to fall off the back. So what we do on this one here is rest the head, top leg comes up high, and I learned this from Brett. You just take your hand underneath and hold it right up underneath the knee, and keep your leg parallel with the ground. You don't want it too far over, because you don't want to rotate in the lumbar spine, because it's more of a T-spine move, not a lumbar spine move. So you can put a pillow or a pad or something underneath there if you like, but I like to have my hand underneath there and I grab it, so I keep it up high. And then the bottom one, I just take the free hand and I'll come down and I'll reach and I'll grab anywhere along the foot, ankle, or calf. And for people that can't reach that, you can take a rope, put it around the foot, and then hold that way. But this is a great move because the cueing is, you know, hold here, hold here. So I initiate the move first with my eyes. So my eyes look to the left, then my head looks to the left, okay? The top leg, I'm actually pushing my leg down into my hand to activate my core, so there's downward pressure. This leg here, I'm actually squeezing the downward leg glute, so I'm activating that glute to get a nice stretch in the front hip flexor. And when I turn, I lead with my shoulder blade, not with my elbow. So I'm actually pulling and leaning with here, and then I'm going to rotate back and exhale as I go, and then come back. So I'm going to review that with you. So what I do is hold here. First I'm going to do is push my top leg down into my hand to activate my core. I'm going to look to the left. I'm going to turn my head to the left, squeeze my bottom glute, pull the heel towards the back of the buttock, lead with my shoulder blade, exhale, and then come back, and then repeat, and back. So I do about 10 repetitions, and then when I get to the 10th one, I hold, and I actually instruct my client to breathe in through their nose, push out their stomach, to breathe with their diaphragm, and just relax into that move. And hold that and do about 5 breaths when you do that. So the sending it out works your diaphragm, stimulates your inner core. So there's a lot of stuff going on in here that you got to cue people on. And then you just reverse it and turn it to the other side when you do it. So the key is to do all those cues in that order, and then switch it and do both sides. And you'll typically feel one side will be easier to do than the other, but I still like for people to do both sides, and I may actually have them do one extra set on the more dysfunctional side until I get them to about even where they need to be. So try that move, see if it works for you. If you have any questions, you can send me an email or you can give me a call if you want to, and I'll be happy to answer any questions that you have got. So Try the move. Let me know how you like it. This is Dr. Perry from StopChasingPain.com. We will see you soon on the other side.